Hi, I'm Dr. Ken Berry, a family physician. For the next few minutes, let's talk about high blood pressure and 9 simple, easy things that you can do at home to effectively lower your blood pressure. First of all, why is that important? Having chronically high blood pressure increases your risk of heart attack, stroke, liver problems, and even kidney failure. It's really unhealthy. So we want to get your blood pressure to the lowest healthy level that we can. And most people think, oh, I have high blood pressure, I'm going to have to go to the doctor and get a blood pressure medication. The vast majority of the time, if you follow these 9 simple steps, you won't even need a blood pressure pill, or you might need a small dose of one blood pressure pill. So blood pressure is super common. There's about 57 million doctor visits a year just in the United States alone, just for high blood pressure and the refills of the medications and the blood work that go along with that. What if you could lower your blood pressure enough to get off this medication and not have to go to all those doctor visits? That'd be awesome, right? It's also estimated that 40% of the people with high blood pressure don't even know that they have it. And so they don't even know to do these 9 simple steps or to go to their doctor and get a pill. So let's go through these 9 steps. And I'm going to try to keep this easy to understand and give you just simple steps that you can do that you can immediately start to lower your blood pressure. So step number 1 is to lower your insulin level. And you're like, how do I do that? So, and then first of all, and then secondly, how do I know if I have high insulin? Hyperinsulinemia is one of the most common conditions that Americans and people in modern society suffer from. It's also the most common condition that people don't know they have, and it's because their doctor doesn't check their fasting insulin level. So the vast majority of people with high blood pressure, aka hypertension, have hyperinsulinemia, and they don't even know it because their doctor's not checking it. So next time you go see your doctor, say, hey, check my fasting insulin while you're at it, and that will help you with these other steps. So how do you lower your insulin level? You do it by eating lower carbohydrate foods. So you're going to eliminate all the sugar and all the grains, and you're going to eat more complex carbs in the foods that you eat carbohydrates in. A lot of people call this a low carb diet or a ketogenic diet, and I've got hundreds of videos on my YouTube channel about this way of eating. It's very delicious. There's thousands of foods to choose from, but as you start to cut out the highly processed simple sugar carbohydrates, you're going to notice that your blood pressure starts to go down. And many people are taking 1, 2, or 3 blood pressure medications. When they start eating lower carb, they notice that their blood pressure gets so low that they have to stop one of those medications, or they have to lower the dosage of their blood pressure medication. That's a sign that you're winning, okay? You want to do that. And so whether you want to follow a low carb diet, a ketogenic diet, a ketovore diet, or a carnivore diet, any of these are great options that will help you naturally lower your blood pressure. Number 2, you got to get rid of chronic inappropriate inflammation. Now, when you sprain your ankle should swell up and be painful and red and warm to the touch. That's inflammation. It's helping your ankle heal. But there are millions of people out there, you may be one of them, who have chronic inappropriate inflammation. And this causes your blood pressure to just be chronically too high. So if you hit your thumb with a hammer, your blood pressure is going to go up. That's completely natural and appropriate. It's going to come back down as that heals. But if you have chronic inflammation in your body every day, whether it's arthritis or whether it's ileitis or whether it's dermatitis, you're going to have higher blood pressure. And so now the good question for you to ask is, how do I lower chronic inappropriate inflammation? You do it by doing the same thing I told you to do in step 1. Get rid of all the added sugar, get rid of all the grains, wheat, rice, oats, corn, get rid of the vegetable seed oils, canola oil, soybeans, safflower, sunflower, peanut oil, corn oils, cottonseed oil. Get rid of all those. Cook in natural fats that humans have used for thousands of years. This is going to lower the level of chronic inflammation in your body. That's going to allow your blood pressure to move back closer to normal. See, when your insulin levels chronically high and your levels of inflammation are chronically high, that causes you to hold more fluid in your body. That means your heart has to pump more blood around your body. It has to deal with more fluid. The way it does this is by raising your blood pressure. So lowering your insulin level and lowering the levels of chronic inflammation lower your blood pressure. Now, I put all 9 of these in order from most important to still important but less important. And so the first 2 are lower your insulin and lower your levels of chronic inflammation. Tip number 3 is make sure you're getting plenty of magnesium. Now, on a low carb or a keto diet, this is super easy. There are many magnesium rich foods on low carb and keto diets. I actually have a YouTube video called 7 magnesium rich foods that you can eat on low carb or keto. Some people will use an electrolyte supplement to make sure they're getting plenty of magnesium. Some people just take just a straight out magnesium supplement because it helps them with constipation or it helps them get better sleep at night. But make sure you're getting plenty of magnesium. There's tons of research to support step 1, step 2, and step 3. You want to get enough magnesium in your diet or as a supplement. Step number 4 is to make sure you're getting plenty of potassium. So you want to get plenty of potassium. I actually have a YouTube video about 7 potassium-rich foods you can eat on low carb or keto. Some people on ketovore, carnivore will take a potassium supplement in the form of a electrolyte supplement that contains potassium. I'm not convinced that that's necessary. It's quite possible that you don't need to get as much magnesium and potassium if you're eating the very low carb ketovore or carnivore options of ways of eating. But if you're eating a mixed diet, an omnivore diet, a diet with plants and animal foods, you want to make sure you're getting enough magnesium and potassium. Step number 5 is you've got to learn how to cope with chronic stress. Notice how I didn't say get the stress out of your life, because that's easier said than done if your stress is coming from your boss or your spouse or your roommate or whoever, somebody you don't want to just, push them off a cliff. So you've got this stress in your life, but if you can learn how to cope with this stress, and the way I did this was by learning about and practicing Stoicism. It's not a religion, it's not a philosophy, it's just a way of learning how to cope with stress. One of the most famous sayings in Stoicism is the obstacle is the way. The obstacle is not in the way. It's all perception and perspective. And once you learn how to let stuff go, that's going to help your blood pressure come back down closer to normal. The next step is to maximize your sleep hygiene. Staying up late and getting up early, not getting out in the morning sunlight, watching TV in your bedroom, all these things are going to lead to increasing your blood pressure. So I actually have a YouTube video about sleep hygiene that's got lots of simple tips and tricks just like these that will help you get better quality sleep, and that's going to lower your blood pressure a little bit. Number 7 is you got to cut out the alcohol. Lots of research shows that the more alcohol you drink, the higher your blood pressure is. All alcohol is poison. There is no healthy alcohol. It's fine to have an occasional mixed drink every now and then, but if you're drinking every day, that's causing your blood pressure to be higher. There's no nutritional value in alcohol. If you're using alcohol to self-soothe or to manage a stressful situation, if that's how you're managing your stress, that's not going to help lower your blood pressure. You got to drastically cut down the alcohol. Number 8, get more sunlight. Now, I mentioned this earlier. How in the world could getting out in the sun with your shirt off in shorts, how can that lower your blood pressure? So one of the many things that sunlight does when it hits your skin is it makes nitric oxide. Yeah, and nitric oxide is known to lower your blood pressure. So getting morning sun not only is going to set your circadian rhythm for the day and help you sleep better that night, thus lowering blood pressure, but it's also going to help your skin naturally create nitric oxide, which is a natural antihypertensive that your body will make if you'll get out in the sunlight every day, preferably in the morning. Number 9 is to stop using mouthwashes that are antiseptic, antimicrobial, or antibacterial. What? You want me to have stinky breath? No, no, no. There's other ways to have pleasant breath. Do not use mouthwashes that kill the bacteria in your mouth. Many of those bacterial species actually make nitric oxide, which is a natural blood pressure lowerer. So stop using any mouthwash or toothpaste or anything in your mouth that kills bacteria. You don't want that because those bacteria are making healthy, natural nitric oxide that help to lower your blood pressure. Now let's talk about 3 blood pressure myths that your doctor might have told you. Number 1 is, if you want to lower blood pressure, then eat less salt or eat a no salt diet, low sodium diet. This has been disproven multiple times. If you eat the lowest possible sodium diet possible, you're going to lower the top number of your blood pressure maybe 3 or 4 points, and the bottom number of your blood pressure maybe 1 or 2 points. That's virtually nothing. That's not going to help you get off blood pressure medications. It's not going to lower your risk of heart attack, stroke, kidney failure. Salt your food to taste. Salt has nothing to do with blood pressure. What you want to cut down on drastically is sugar, not salt. Number 2, stop drinking caffeine. That raises your blood pressure. So when you drink a cup of coffee or a caffeinated beverage, that does temporarily raise your pulse and raise your blood pressure a little bit, temporarily, but it does not contribute to essential hypertension, which is what 93% of people with high blood pressure have. They have essential hypertension. That means effectively that the doctor doesn't know what causes it, or that maybe it's genetic, we don't know. But caffeine does not contribute to essential hypertension or just chronic high blood pressure. That's a myth many doctors still repeat. And then number 3, if you've got high blood pressure or want to avoid it, then you need to avoid saturated fat in your diet. Research is very clear that saturated fat does not cause high blood pressure or hypertension. In fact, one of the ways that people lower their blood pressure so much that they can get off their blood pressure medicine is to eat more saturated fat in the form of a ketogenic, ketovore, or carnivore diet. They get rid of the vegetable seed oils and they use naturally occurring saturated fats like butter, like beef tallow, like lard, bacon grease, like coconut oil, olive oil, avocado oil, and their blood pressure comes down. Saturated fat is not causing your high blood pressure. It can actually help you lower your blood pressure. Now, with all this talk about high blood pressure, I want you to know that your doctor's office is probably checking your blood pressure wrong. This happens so commonly, so ubiquitously, that I actually made a video about how to check your blood pressure properly. You can check that video out. I'm going to link to it here at the end of this video. Also, there's a list of medical conditions that can contribute to secondary hypertension. And those are conditions that changing your diet, changing your lifestyle are not going to get rid of. You need to know what those are just in case you have one, and I'm going to have that video pop up right here at the end of this video. So watch the video about how to check your blood pressure properly. That's very important. And your doctor is doing it wrong. And then number 2, make sure you don't have a secondary cause of hypertension by watching this video when it pops up. That's it. I promise that if you focus all your time, energy, and effort on these 9 easy steps and focus most of your effort on the steps 1, 2, 3, 4, and 5, you're going to lower your blood pressure. You may be able to lower it enough that you can come completely off your blood pressure medication or return your blood pressure to normal if you have high blood pressure and you don't even know it because you haven't been paying attention. If you know someone with high blood pressure, please consider sharing this video with them. And don't forget that I've got hundreds of other YouTube videos that will help you with many other very common chronic conditions. Now, If you like the idea of decreasing your blood pressure with diet and lifestyle changes, but you don't have any support at home, we have a very large support community that's very loving, very accepting, and who will take you by the hand and show you how to do it. There are thousands of people in there that used to have high blood pressure who don't have high blood pressure anymore. There's a link in the show notes if you want to join us in the Proper Human Diet community. This is Dr. Berry. I'll see you next time.